We are going to talk about hygiene. What is hygiene? Hygiene is to keep things clean. Okay, so I don't know if you know about me, but for those who don't know me or know about me, I am a dentist. I'm a professional and I'm working as a dentist. Okay, so I've had my degree from UP, and I have been practicing for from 2013 onwards. So it's been quite some time. So what I'm going to tell you is what we usually tell our patients. Okay. So a lot of parents have this question: when should we take our kid to a dentist? So the simple answer is you should bring your kid to a dentist when the first tooth erupts. Okay, so when you see the first tooth in your child's mouth, that is the time when you start a regular dental visit. Okay, a dental visit does not mean that you have to get something done. It just means that you go and get yourself checked up. We do checkup, and then when you come for regular checkup, then only we can give you the oral hygiene instructions. Then only we can tell you how to brush, how much paste to use. There is a lot of misinformation. People don't know how to brush and how much amount of paste to use. So today we are not talking about the adults. Today we are going to talk about the kids, the tiny ones that we have. Okay, so let's start it. Uh, the oral hygiene, or for that matter, your teeth start building up when you are in your mother's womb. So, for all the mothers out there, whatever you are eating is being consumed by the child, and from what you are eating is what the child going to use to get his teeth. Okay, so any interruption when the child is in your womb can cause to some kind of disruptions later on in life. Okay, another thing is once the child is born, so a lot of parents have this misinformation that the oral hygiene will start once he has a lot of teeth. No, oral hygiene starts once the child start having milk. So you don't have teeth. So what are you going to do? How are you going to make sure there is oral hygiene? Simple. Once the child feeds either breast milk or bottle milk, once the child has had their feeding, then what you do is you take a cotton dipped in water, or maybe a small cloth, cotton cloth. It should be soft. Okay, and dip it in water and clean the gums all around, overall, of your child. So what doing that does is, number one, you are cleaning it up, so the chances of any kind of fungal infection, because that is what kids have, if a small child does not have his mouth cleaned up regularly, the parents are not cleaning up, then the child might have oral fungal infections. Okay, because the milk can get retained in the cheek or in the vestibule, on the spaces between the gum and the lip, and then uh, the fungus can grow over there. So you can have oral thrush, the fungal infection. Small child can have, because they don't have the strong immunity that we as an adult have. Okay, so it's very simple. Just dip the cotton or maybe the cotton cloth and wipe around the mouth. Another thing that cotton cloth wiping will help your child is, it will help in soothing the gums later on in life. Okay, so once the child is, say, maybe 4.5 month old, 5.5 month old, or maybe 6 month old, when the first milk tooth starts to appear, they have this irritation. Okay, so when you are, massaging the gums, cleaning them up, that irritation goes down, the child feels good about it. Okay, so you can use that. Or if you are an extra person like me, what you are going to do, you're going to buy this is a finger brush. Okay, so how does this work? Let me show you. I had this for my child. Okay, so what I used to do is a very simple thing. I used to see, this has small bristles. I don't know if you can see it in the camera, but this has small, very soft bristles. So once my child was slightly older, not just newborn, I only used cotton to clean up. But once he was, say, maybe 3 month old or 4 month old, then I started with this finger brush. So you just put it in your finger and just gently swab around the gums. Okay, so I used to do this, and later on, I had, obviously now I don't have because my child has chewed it out. So I had actually the whole set. So there was this finger brush, and then there was soft silicone bristles, okay, to bite on for the child. So what I used to do is I used to give him the soft silicone, and he used to bite on it. Obviously it was only when he had gums. Once he had graduated to having teeth, I did not give it to him because child can easily tear it up with the teeth, and if it tears up, then what happens is that the pieces of silicone can break. So we don't give that. So when the child is small, say 3 month old, 4 month old, 5 month old, this this delicate bristles, they won't hurt the child, but they will help in massaging and cleaning up the teeth. So this used to be there, and obviously we have the case for it, okay, to store it up. So what you do is you clean it up, you dry it, obviously dry it, not it should not be wet, or else it can get moldy. And um, we keep it clean. So I used to travel in metro, so I used to keep this in my bag always, because child can have they children, they get hungry anytime, anywhere. Usually it's a schedule in every 2 hours, but life doesn't stop. So I used to carry this in my bag. So once he had his meal, then I would gently just pop it in my finger, rinse it. Obviously I can't wash it in metro, so I would just keep it in the box. Once I reach my destination, clean the box, clean the bristles, and dry it, and then keep it back in the box and ready to go. Okay, so this is one thing. Now, if the child is between the age of, say, 6 months to 1 year, when he is very small, okay. So again, these kind of things are going to go. One of the things that parents are doing wrong is they are bottle feeding the child beyond the age of 1. Okay, why that is wrong is, now when you are small, when you don't have teeth, the way you bite, chew, you have a lot of things going on. Okay, so I am not sure if the video is working. Let me check, just give me a second. Okay, the video is working. I'm so sorry. Uh-oh. I am sorry, just give me a second. Okay, so we are back. Sorry about this. So what happens is, once the child is between the age of, say, 6 months to 1 year, and you are bottle feeding the child, so when you're small, the way you close your way you make suction so that you can swallow the food is through your tongue touching the lip, okay, and creating a seal. But once you have your teeth, the seal goes back, The tongue touches the roof of your palate and then you swallow. So if you are bottle feeding the child, it disrupts this swallowing process. Okay. Another thing is the tongue would be pressurizing the erupting tooth, or the bottle would be pressurizing the erupting tooth. So there are chances that the front of the teeth are going to go out. That is same with the thumb sucking. Thumb sucking it's more, but with bottle feeding it is less, but it's still there. Okay. Another thing that happens is when you bottle feed, especially for the people who are feeding their children at night before sleeping, and the child sleeps while drinking the milk through that bottle, you will have something that is called bottle caries. Okay, nursing bottle caries. What happens is you have caries on the front of the teeth. Normally caries is not there at the front of the teeth, but with bottle caries you have caries at the front of the teeth. Okay, so what will happen if you have caries in the front of the teeth? These caries are going to spread to all the teeth, and child cannot bite, child cannot chew. I've seen a lot of severe cases where the children were feeding through bottle when they were even 4-year-old. Okay, so what happens is, yeah, the parents, for the ease of giving milk to the child, you give it through the bottle. But what happens is they start having issues in their teeth, and if they can't chew, they cannot develop proper oromotor functions. They need to chew, they need to talk. These are important for the muscles to work properly. So if the child is not biting on, they have issues with the eating even later on in life. Okay, I have seen that the child becomes picky because initial years he was not eating. So later on, they prefer softer food than the chewy food. They don't like to, try new things. It's not with everybody, it's not hard and fast rule, but it happens. Okay, and then there is also the issue that if you're bottle feeding the child beyond the age of 1, then the caries, chances of caries developing is also very high. So bottle feeding of the child, I strictly tell my patients not to feed your child with bottle once they are once they have had their first birthday. Same is with the sippy cup. You can use it for transitioning, but using sippy cup beyond, it can cause issues. Another thing, oral hygiene for the small kids, pacifiers. For the parents who are giving pacifiers, please don't put in pacifier in your mouth and then give it to the child. Your mouth is filthy. Don't give it to your child, because you as an adult have developed a lot of immunity. The child has not. So the child might have issues, might develop problems. Another thing is, what can happen is that when the pacifier is there, you put sweet or honey. No, don't put anything on it. Okay, give it separately. When you are giving these kind of thing and it's going to stay in mouth, again caries. Okay, the children's teeth are very soft. They are not as hard. So the caries can cause a lot of issues, and caries can spread a lot into a lot of teeth. So what happens is when your child is, having pacifiers with sugar or honey for extended period of time, you are going to have caries in the permanent tooth. And as it is, sugar is not advisable for the children beyond below the age of 2. Okay, it's not very good, very healthy. No juices, no cold drinks. Please don't give juices to your small kids. Okay, they don't need it. They can have the fruit. If they are old enough, they can have the fruit. If they are too young to have fruit, they are too young to have juice. Simple thumb rule. Okay, so then how do you transition? Now I have, so when to start brushing, proper brushing with paste. Okay, so it's, if your child can spit out properly, then you can start with the paste. If your child cannot spit out and it's taking everything inside, either don't start with the paste or start with the paste that don't have fluoride in it. Okay, so paste like this Chico paste, it does not have fluoride. This is for kids. younger kids. Okay, usually kids below the age of 2, no fluoride should be given. It is advisable until and unless your doctor tells you to because of some issues. Okay, again, Colgate has this paste. This is also, I think, without fluoride. It is not mentioning it. uh, I'm not sure about the Colgate one because I can't find if it is without fluoride or not. It does have, sorry, the Colgate 2 to 5 year one has fluoride. Okay, again, like I said, for child who is, very small, less than 2 years, you can use this. And the amount of paste is in the size of rice grain, 1 grain of rice. That is how small the amount of paste should be. Okay. Again, this pigeon also, this is fluoride free. This is also fluoride free. This is also the paste which is fluoride free. It is good enough for kids above the age of 2. Maybe even above the age of 1, once the child starts spitting, you can use this also. This is also very good. I actually use this for my son. He's 3.5 year old. So what it does is it fights with the bacteria and it doesn't let the slimy layer form. So the caries has less chance to react. Once the child is above 2 years, you can start with the child specific fluoride paste because adult paste has a lot of fluoride. Okay, we don't need that much of fluoride for kids. We do need for some kids, but the dentist will tell you if you need higher doses of fluoride. Otherwise, normally every kid who is following a healthy diet, okay, if you're munching on chocolates the whole day, fluoride is not going to help you out. So you can use this. This is fluoridated Colgate 2 to 5 year old. Pediflor again for kids. I think this is also fluoridated. Um, yes. So very lightly fluoridated. This is also very good. I'm planning to start using this for my son. So these are there. Pediflor is there. Colgate is there for the kids who are older than 2 who can spit. Okay. For kids who are younger than 6, parents have to be present there to help them with the brushing because until and unless you develop the wrist movement properly, and that develops at the age of 6. Okay. So till then the child needs to be assessed by the parents. You can't just let them be go brush and they are doing it. No, they can't do it. They are not old enough to manage that. Okay, so if the child is between the age of say 1 year to 2.5, you can extend it to maybe 3 to 4 years also, non-fluoridated. If your child does not have caries tendencies, he is eating healthy food, he is taking a lot of green vegetables, he is eating a lot of roughage, then you can do it. The type of brush should be very soft, not hard, and small. Okay, the kid is very small, and this is only to start making him understand that we need to start brushing. So, and how you are going to impose it is by doing the brushing in front of him yourself. The brushing needs to be twice daily, and every time he has any meal you need to make sure the child brushes, or you need to make sure the child rinses. I'm sorry, not brushes, rinses. Brushing is 2 times a day. Then for the older kids, okay, so this is also brush which is for 0 to 2, but this I don't think this will work. Yeah, so this is something I'll advise for smaller kids. You have 2 teeth, 4 teeth, 5 teeth. For 2 year olds, this is enough. By the time your child turns 3, he will have a lot of teeth. Okay, so then you can use something like this, or something like this. Okay, this is soft, it's not hard. It should be soft. You have to make sure it's not very hard, but it is firm. Okay, it's soft but firm. This is what my child is actually using. It is his brush. I have to go and wash it now. But this is what he is using. So this has grip and everything, and this is small. You can see how small this is. So this was his brush till the age of say 1.5 years, and then we had another brush, and now currently for past 2 months now he's using this. Now I'm going to change this brush very soon, and then we are going to have another brush. So once the brush is fraying, you need to change it. And in any ways, if it is not fraying, then also once, in every couple of months, please change the brush. Don't use the same brush for a long period of time, because you might then end up with a lot of bacteria in your mouth. So something like this for small 6-month-old to maybe 1.5-year-olds. And then once your child is slightly older, 3-year-old, 4-year-old, so you can use brushes like this, 5-year-old, 6-year-old. Okay, so these are the brushes that you can use. So what happens is the size is slightly bigger. Okay, not a lot bigger. It is still small enough to reach all the parts of the mouth, but it is slightly older. And when they have this, different types of shapes and sizes, so the children love it. They feel motivated. So you can find something that your kid loves. Say maybe he's an Avenger fan, he's Captain America fan, you can find a brush with Captain America. He is an animal fan, so he can have something like this. My kid wants this one, the Minion one. I've told him he need to get a little bit older to go for this. But yeah, these are the things that the child can have once they have the full dentition. They have a lot of teeth. So to brush, to use, they can use that. Okay. And as always, I am being extra. So there is something like this also. This is for older children, the children above the age of 5. So this is an, electric brush. It rotates on its own. So this you can give for a child who is maybe 6 and older. For them, this is something that can be used. Okay. So these are the different ways by which you can maintain the oral hygiene. Then one of the important thing is, whenever the child has something sticky, say chocolate, chips, biscuit, make sure you ask the child to rinse properly, and you see that it is not still sticking to the mouth. It is important that it's not still sticking to the mouth. You need to ask the child to rinse, and you need to see if it is sticking, please brush it up. You are not there, then ask the person who is at home, who is taking care of your child, to do that. Okay. So another thing for older children is, please encourage them to have fruits and vegetable and things like that. That helps in self-cleansing the teeth. So you have less chances of cavities. Make sure that you are not feeding your child when the child is, almost sleeping. For bottle feeders, this is very important. Even for breastfeeding mothers, please make sure that it is clean. Once the feeding has stopped, you make sure you clean it up for the infants. And for the older children, you can ask them to rinse. You can teach them how to rinse. This can be another important thing. For older children, it's easier. You can instruct them. You can teach them. There is so much available online nowadays. So I think we have covered a lot today. If you have any issues, any questions, please ask me. And please like, share, and give your comments. Thank you, and bye-bye. See you next time.